Hi, I'm Dr. Jill Moran from Edward Hospital's Perinatology Clinic. Ultrasound is an imaging modality that's commonly used during pregnancy. It uses high-frequency sound waves that bounce through the tissues and then back again to the transducer to create the image on the screen. The doctor or technician performing this procedure will place ultrasound gel on your abdomen. This is a type of conductive medium that helps the transducer emit and receive the sound waves through the skin. This transducer will be moved across your abdomen as the fetal structures are examined. In the first trimester, ultrasound is used to locate the pregnancy, see the number of fetuses, and where they are located, as well as to date and check the health of the fetus. In the second trimester, it is used to look at fetal structure, looking for evidence of birth defects, assessing for risk of chromosomal abnormality, and also confirming that the dates are correct. In the third trimester, ultrasound is most commonly used to check for fetal growth, monitor the fluid and health of the fetus, as well as to confirm the location and the function of the placenta. You can see here, I'm going to enlarge on the screen, is the baby's chest, and in that we see the heart beating. You can see this has the 4 chambers of the heart, and we can listen to that now. His heart rate is very normal. It's in the 140s. They cooperate, we can usually get a profile picture, which is always nice to take home, and there we go, we have that very nicely here. This is the forehead, nose, upper, lower lip, chin. We also, during the ultrasound, look at the limbs. We look to see that the bones are straight. We measure them for their length. Look at the fingers. See how many that are straight.
That's amazing.
If possible, families can find out if they're having a boy or a girl, and I know Sandy and Mike do not want to know that. So we'll keep that a secret. Sometimes color is used, and that helps you identify where the cord is located. Sometimes we use it to map the vessels inside the fetal abdomen and body as well, like when we're trying to look at the aorta or the arteries to the baby's kidneys. That is an adjunctive modality that can be helpful as well. Cervix can also be looked at abdominally. And so here's what we're looking at. Here, the fluid is the amniotic fluid. This grayish structure is the actual cervix. And if that looks short, then we have a concern that there can be preterm delivery. So that's the importance of looking at the cervix. During assessments of fetal well-being, the fluid is measured by measuring the one fluid pocket in each quadrant. We kind of artificially divide the uterus up into 4 different areas, and the fluid in each quadrant is measured. There's a large variation in what can be considered normal, and there is a very normal amount of fluid here today. The 3D ultrasound is helpful when we're trying to evaluate like a fetus who might have a facial abnormality, sometimes even spinal or hand or foot abnormalities. It doesn't help as a 3D mode so much for the inside structure, it's more external structure. Ultrasound can be a very useful tool to assess the health of your unborn baby. It has been shown historically to be quite safe because there is no radiation, and there have been no documented cases of any injury to fetal or maternal tissues.